and Facebook. So hello everybody, welcome back to our fertility Q&A. We're here with Dr. Jessica Bauer tonight of IVFMD, so she'll be joining us shortly. We will look for her to pop up, and we're going to start talking about all kinds of interesting things that we're going to address for fertility. We are going to be answering your questions. We know that you've submitted them early on, so thank you. And we have plenty of questions to get through, but also we are going to answer your questions live as well. So if you want to type them in the chat, you can do that. And also you can type them in on Facebook and YouTube as well. And so as soon as we see IVFMD pop up, we will go ahead and in Instagram we'll be able to let her in so we can take a look and see what we can address tonight. But I want to thank you guys for joining us. I know you have a busy schedule, and I know that this usually is very intense because we go through a lot of information all at once. Oh, I see her now. So we are gonna, let me just go ahead and see if we can, okay, so you can ask to be on the live, I believe, Dr. Bauer, because I see that you've joined, so you can, I don't see it popping up yet, but I will soon. So yes, you can ask, there we go, okay, let's see her now. Yes, this is Dr. Bauer's first Q&A, so we're excited to have her knowledge, and there she is, yay!
Hi!
Okay,
I'm sorry, I'm new to this.
That's awesome, because we're officially like triple streaming. This is fun, you know?
Yeah.
We have a lot of fun with this. We want to also let you guys know that if you like to share this, please do share with a friend who might be experiencing any issues with fertility, endometriosis, PCOS, who might be, silently struggling, because we are here tonight to answer all of your questions. And we were just laughing about the video that's been going around with the little cat in the Zoom session. So we're like thinking maybe we should have like a little Zoom filter, little cat filters tonight, but we don't. So we are here though to start off with questions that are being submitted through Instagram and also through Facebook Live and also YouTube. So if you can join us tonight, just, if you have any concerns or questions at all, don't be shy. Please ask, and we promise to do our best to get to those questions. And I know for those of you who don't know Dr. Bauer, Dr. Bauer, please introduce yourself and
Absolutely.
where you are.
Yeah, sure, great. So hi everyone, I'm Dr. Jessica Bauer. I am the newest physician addition to IVFMD last year. And I work primarily out of the Boca Raton office. And I'm very happy to be here. And I'm originally from the Northeast, but came down to Florida, where all my family migrated to about 3 years ago. So very happy to be here and looking forward to answering all of your questions.
Oh, great. I'm so excited because your background is so interesting to me. I was like, wow,
thank you.
Neuroscience and nutrition.
Yeah.
I mean, so I'm like, yeah, this is right up our alley because we have a lot of nutrition questions today too. So
perfect.
So let's go ahead and jump in then. The first question we have here was submitted is about PCOS. And so we work a lot with PCOS, and I know that you practice those too. And someone is asking, how many kids can a woman with PCOS most likely have?
Well, that's a good question, I guess. So a woman with PCOS can really, if her PCOS is under control, can really have as many children as she wants. It really depends. It's a tougher question to answer because it's broad, but it really depends specifically on the person and the degree of PCOS that the patient has. And like I said, there are some PCOS patients who with, supplements and medication can help regulate the periods and regulate the metabolism such that if they're ovulating on a regular basis, they're able to conceive, just like any other individual without PCOS. Certainly, if a person with PCOS requires assisted reproductive technology, we certainly have. There's generally not an egg quantity issue, but sometimes there can be an egg quality issue. So taking measures to help improve the quality when you are dealing with PCOS is really the key to making people who want children who have PCOS successful. I don't think there's any particular number that I can say that you can or cannot have. It just matters the degree of PCOS and how well controlled it is, basically.
For sure. And we might
Yeah,
see a lot of follicles on the ultrasounds and that sort of thing. But, some of them are good, some of them are not so good. But we've had patients
exactly.
who have 5, 6 children with PCOS. So, I mean, it's
Absolutely.
definitely it just don't let yourself be limited by that diagnosis for sure. Um,
Absolutely.
and another PCOS question we have is what
Hmm.
age should a woman with PCOS start trying to get pregnant for best results?
I think that uh, that really is the same for if I would answer that question without the PCOS caveat. Um, and so basically what I tell all of my patients, regardless of their diagnosis, is, of course, as women, we're born with however many eggs we'll ever have, and over the course of our life we lose them. So but the rate at which that happens is different for every woman. And so what is really important is to be proactive, um, with your reproductive process in understanding what your general ovarian reserve looks like, so you can have a basic idea about what your reproductive window might look like. Is it a little bit shorter? Is it longer? Is it shifted one way or another for various reasons? And so I think certainly, the magic number that everyone talks about is the age of 35, when we know that egg quality and quantity does start to decline at a rate much faster than when we were 20, as an example. And so starting to think about having a family or taking measures to preserve your fertility before the age of 35 is definitely a very safe choice.
For sure. And also, I think that we also have so many ways to help, in different age ranges and all of that.
Yeah.
But it is good to pay attention to those things even before you think you even might want to get pregnant. It's like, all right, just to see, if there's going to be obstacles.
Absolutely.
Because the biggest thing we hear from patients all the times is, I wish I would have known this sooner. And that's like heartbreaking,
100%.
I know, like for you,
Yeah.
like, oh God, I wish like we could transmit this information telepathically to every woman who is
Of
like,
course.
considering having children at one point, whether she has PCOS or endometriosis or whatever, or maybe doesn't even know that she has that. So at this
Exactly.
point, because a lot of women take a long time, many years to get that diagnosis of endometriosis or PCOS. So it's just good to have a preconception visit, just like you would plan your wedding. Take a little time to plan your conception strategy, I think.
Absolutely. I couldn't agree more
Um,
with that.
and I know you guys are big on that because there's actually an inflammatory panel that you do, I think, as part of your workup, which is really unique. I was on your
Yeah.
website reading about that today, and I was like, oh, this is great to know your level of inflammation. And so,
Mm-hmm.
PCOS is inflammatory, endometriosis is so many conditions.
100%. Yeah.
And if you know how inflammatory, the condition is inside your body, it can give you a little chance to work on that. So I think that's through a blood panel that you guys look for through biomarkers and different things. That's really
Absolutely.
cool.
Yeah.
Mm-hmm.
Yeah. Simple blood test, and in combination with a patient's history, can give us an idea about the sort of systemic or body-wide inflammation that can have its effects in the uterus and the ovaries and all sorts of places that can contribute to difficulty conceiving or recurrent miscarriages or anything like that. And we work with patients every day to help lower that level of inflammation to make them more successful.
It's so awesome you guys do that. It really is,
Yeah.
because it's an insight that you normally don't get to just a regular checkup and that sort of thing.
Yeah.
So our next question is, can IVF, IUI, or other treatments help a woman get pregnant who has PCOS? This might be the last PCOS question, but for sure, I'm going to let you take that. Yeah.
Yeah, no, for sure. Absolutely, yes is the answer to that question. There are many women who with PCOS, and again, it goes back to sort of what I said before, that there's certainly a spectrum of PCOS with, a spectrum of the disease being, minor to more moderate to more severe. And depending on where you land on that spectrum, a different treatment might be needed. So if the problem is purely that that a patient, is not reliably getting her menstrual cycle, and we can help her get her menstrual cycle to ovulate on a regular basis, then absolutely something like IUI or intrauterine insemination can be very helpful, because it helps to put the egg and the sperm in the right place at the right time, which previously was not happening. So that certainly can be beneficial. There are some couples that need to, for one reason or another, use IVF to conceive when the female partner has PCOS. But certainly both are very viable options for conceiving for women with PCOS, and really a conversation and an evaluation with you and your reproductive endocrinology and infertility doctor will help know which of those plans is right for you.
For sure. We definitely emphasize an integrative approach as well. And I know you guys do too. Acupuncture is one of the things that we use for PCOS quite a bit, to help with regulating the cycle and helping with stress and blood flow, and inflammation as well.
All those good things,
nutrition, and we work with some meditation during the treatment, that sort of thing, because we know it seems actually more and more also with this whole pandemic that if we're not addressing the anxiety and the depression and these things that can also be a little bit more common in PCOS as well, that it's not addressing the full picture. So, and definitely we're more than just our ovaries. So we need to look at, the big picture. And I think that having a group of practitioners to support you, whether it be your therapist, your IVF acupuncturist, people that understand you and what you're going through, is very important. So
I agree
having
completely.
a good team around you is really helpful as well. You're not alone. That's why we're here.
No, definitely not alone. Lots of people to help.
For sure. And we have another question. Actually, somebody who was just writing in on Instagram. I'm taking over-the-counter pills called Prep to help sperm reach. Okay. Oh, okay. So it's a pill called Prep. I'm 33 years old. I do get my period every month, and no luck. I'm not familiar with Prep.
Neither am I. I'm not sure. That's a vitamin that the female patient is taking.
Apparently, it looks like, yes.
Okay.
So we'll have to research that one.
I haven't heard of that one, but there are certainly, depending on what you're using the supplement to treat, there are many high quality supplements out there that can help. But it's really important that you also do your research about what a high quality supplement is, because there's unfortunately lots of counterfeit supplements out there, and even stuff on Amazon that you can get what's in the bottle is not what you're actually putting in your body, which can be can do more harm than good. So seeking the advice of someone who is very familiar with the supplements, someone like me, someone like we have our nutrition expert who works at IVFMD named Marta. She also works exclusively, to make sure that we, as a practice, carry the highest quality supplements for our patients. So that's not to be overlooked, for sure. That's super important. I'm sorry, I'm not familiar with that one, but.
Definitely, she's wonderful. And some of the prenatals on Amazon are really alarming. I saw one that had a ton of vitamin A, which I'm like, wait a minute. It's not supposed to be there. I mean, it's supposed to be in that amount, for sure. But, those pharmaceutical grade, vitamins are held to higher standards. There's GMP certification. Obviously, it's not, the FDA doesn't have any regulations over supplements, I don't think. But at least, they do say this is what is in them, and there's truly those ingredients in them. So that's what you want to, check. And there should be a symbol usually on those, or to tell you that.
Yeah.
And there's
There was
a few good
actually,
brands.
sorry to interrupt. There
Sure,
was
no, no.
actually a recent, it circulated among the doctors at IVFMD. There was a recent, I believe it was in the New York Times article about specifically prenatal vitamins, that when they did like an exhaustive search, found some that had like low level lead in them, which is just
Yeah,
mind blowing and so scary. So
yeah.
it's a very real issue.
Yeah, and
Yeah.
unfortunately, it's definitely rampant. So those things, and also, yeah, if you are getting your period every month, but you're still not getting pregnant, and it's been a while, then definitely get a checkup to make sure.
Yeah.
We know your tubes could maybe be blocked, or the sperm count could be low, or I mean, there's so many things that could go on. So we hate to see people spin their wheels and
Right.
and not know what the issue is. And take supplements, blindly without knowing why. So,
Yeah.
I missed a question actually here. What is the best diet to follow? I was talking a lot about nutrition. I knew it. That's good. So it's because we're here. What
Yeah.
is the best diet to follow ahead of IVF for someone who has Hashimoto's and PCOS?
So the best, the overarching principle when it comes to nutrition and pregnancy and IVF and fertility treatments and all of that kind of stuff is that you really want to be at your healthiest and optimized before you go into those processes. And so and I think it's a really important concept to understand that even if that takes a couple months, it's really important that you get there before jumping right into any sort of treatment or trying to conceive. I think that is there every diet, a person's diet is very individualized, right? And not one blanket diet is going to work for every individual. I think a well balanced diet that focuses on lean proteins like chicken and fish, and also things like legumes like beans and stuff like that, and that's high in vegetables, and low in what we call refined carbohydrates, is really the best approach. And generally, really everything in moderation is super important. You shouldn't be only eating beans or only eating vegetables. Your body needs protein from various sources, and vegetables and vitamins and minerals from lots of different kinds of foods. If you're, if your goal is weight loss for the purposes, if you're overweight or obese or anything like that, that certainly can contribute in it. And if you're looking to lose weight, you also need to be very mindful of portion, and the amount that you're eating, and making sure that you're not going for seconds and thirds and fourths, and that you're sticking to the lower fat, less sometimes less calorie dense foods, to assist with getting pregnant. And for some people that means sticking more to a keto diet. For some people, that means just using something like Weight Watchers, which can help you track and have a better understanding of what you're eating. But doing extreme things is really never the answer when you're talking about pregnancy and IVF, regardless of what medical condition you have. So something that you can maintain over time is really what's best.
Yeah, like you can see yourself doing it when you're 80. That's what we're saying.
Yeah.
Yeah,
Exactly. Yeah.
and I mean, there's a lot to be said for Mediterranean diet, because
Yes.
we do give one that's like a 6-week meal plan just to kind of start off our patients and us, and say at least here is some recipes that might be helpful, and it's gluten free for 6 weeks. So it's just a little bit of a rest from gluten sometimes. I don't know, it's not a bad thing, and apparently with Hashimoto's, there's some research out there that says it might be helpful to eliminate gluten or to lower it in certain
Absolutely.
cases. So,
Yeah.
but I would say with those two conditions, it would be good to talk to a nutritionist if you're trying to get pregnant, because you're going to have to look into what to do during pregnancy too. So make sure everything's happy and working together, and definitely the thyroid, is really important for pregnancy health too. So.
Absolutely. Couldn't
So
agree
go
more.
see
I love
Marta,
the Mediterranean
Marta.
diet. Yes,
Yes.
Marta.
So, and so we have, let's see, I'm jumping around, but we've got a lot of questions here. So I'd love to, I'm going to jump into this one submitted earlier. I have one baby. I'm age 35, trying to conceive second baby. What can I take to improve ovarian reserve?
I'm sorry, you cut out for just a second. Would you be able
Oh,
to
okay.
repeat the question? I'm so sorry.
No, that's no problem. Okay, so she's saying she has one baby. She's age 35. She's trying to conceive her second child. What can she take to improve ovarian reserve?
So they're really I wish I had a magic pill to to improve ovarian reserve. I think what the again what the principle is to really optimize things and really optimize what you have as a 35-year-old, and also being cognizant that at 35 that egg quality and quantity can start to go down. So it may be beneficial to if she's been trying for 6 months, to definitely seek some guidance, just to at least get a baseline as to where she is, because certainly it's wonderful that she was able to conceive her first child, but things can change over the course of the over the course of time. And so generally what I like to see is I like to have women on like we talked about, sort of a high quality prenatal vitamin. That's really important when we're talking about ovarian quality. Something like a CoQ10 is a supplement, is exceedingly important, and also making sure, like I said, about the prenatal vitamin. But and there are, from a holistic standpoint, I think also incorporating things like acupuncture and a healthy diet are all going to help improve ovarian function from a general perspective. And making sure and just identifying if there are any other issues when the person is trying to conceive. But definitely CoQ10. I'm a big CoQ10 fan in terms of nourishing the eggs.
For sure, yeah. And I've been reading about alpha lipoic acid a lot lately. I'm pretty impressed with that one, I mean, it's a
Yeah.
nice antioxidant. It has research even during pregnancy, which is really rare. You don't see a whole lot of studies done on supplements for during pregnancy. I mean, it's kind
No.
of hard to do
Or
those.
pregnancy at all.
In pregnant, yeah, it's kind of like it's very difficult. So I was researching it for glucose issues with PCOS, and I
Mhm.
was like, oh wow, it was studied for early pregnancy loss even. So I mean, it
Yeah.
was very interesting. So alpha lipoic acid now is in some of the fertility supplements that are out there. That, not
Yeah.
sure if you guys use Fairhaven, but there's a FH Pro that I've come across that it's pretty good. And it does have a mixture of the Avositol with alpha lipoic and CoQ10 and resveratrol and all these, vitamin
Really
E, just like
high. Yeah.
right. And it is actually used in fertility clinics in many places. So there's no herbs in it. So a lot of people can use it when they're, obviously check with your doctor on that one. But there's definitely some benefit to working on these things ahead of time, giving yourself,
Yes.
like we had a little quiz on our Instagram, like how long does it take to improve egg quality? I mean, you can't grow new eggs, but you can try
No.
to change, improve the ones that you have a little bit. That they have shown that. And now that there's so much more research about, egg quality in general and what can help. And it does take a couple months, like 2 to 3 months,
Hmm.
sometimes longer, to see a
Yeah.
difference. So be patient with yourself when you're doing that. But you can see changes. And I think you guys do a lot of genetic testing on embryos. So do you find that you're seeing differences like from one cycle to the next a lot of times, like during a
Definitely you can see, if a patient sort of like goes into an IVF cycle, sort of without optimizing things initially, and then
Mhm.
they, maybe with another clinic, and then, come to us and say, oh, have you taken a look at your systemic inflammation and all of that kind of stuff, and have you optimized things, and do we have you on alpha lipoic acid to
Mhm.
really get, antioxidants working in your favor to help protect the eggs that you do have left and controlling that inflammation. We do see, we often can see a higher egg yield when we do an egg retrieval. And then, because IVF is very much so a numbers game, unfortunately. But if you're able to capture higher quality eggs, then the likelihood of ending up with genetically normal embryos at the end, your chances increase if we can do that. So I definitely, from experience, have seen that for sure.
Awesome. And
Yeah.
that's their only way to see if egg quality is improving, honestly, because there's
Yes,
no other way. I mean, there's not any test that can show, right, that I know of, like any blood test that
correct.
can say, because AMH can fluctuate, it's not, and and FSH can fluctuate, but it doesn't tell you, are they getting better? Like as far as egg quality, it just doesn't. So that's like
Exactly.
until you
Yeah.
get pregnant and or you have an IVF cycle, you just really don't know how
Yeah,
it looks from there. So,
absolutely.
um,
Yeah, no, I agree completely. Can you still hear me okay, Dr. Duro?
yeah. Oh yeah,
Okay,
yeah.
perfect. Great.
You're
Just
good.
checking.
Yes.
Okay.
And let's just tie this in because someone is asking, can you take supplements during IVF stimulation?
Definitely. You can definitely take IVF supplements during stimulation. We do like you to continue them. There are, there are exceptions. There are some that potentially could. I'm not sure if I got kicked off or you got kicked off of VLive, but
That's okay. That's all right. We're
everything's
still
looking
hearing
okay.
you
All
on
right, just
Instagram,
checking.
so
Dr. Duro's
okay.
the tech support here. I'm just along for the
Yeah.
ride.
We're
um,
doing our best here.
yes, absolutely. So I forgot what was the question we were
Oh,
answering?
supplements during IVF
Supplements,
stim.
yes.
Yeah.
So there
Yeah.
definitely are some supplements that potentially could interact with some of the medications that we give you, or if because an egg retrieval does require some IV sedation, which is a form of anesthesia. So sometimes we might ask you to stop a specific supplement, but in general, that's pretty rare. In general, we do like you to continue your supplements through egg stimulation.
Very good. Yes. And someone is asking, wow, there's so much supplement questions, guys. I know this is awesome. Okay, so if you have, I just passed it here. Yes, you answered that one. Okay. Can can a woman with PCOS have several positive ovulation tests in 1 month? Yes, you can, and you can
Yes.
explain why. Yes.
Yes. I'm happy to handle it if you want to.
Go ahead. Yes, take it
Oh,
away.
okay. Yeah.
Yes.
So yes. So the one of the hormones that is detected in a home ovulation test is something called luteinizing hormone, or LH. And in women that have PCOS, one of the hallmarks or the characteristics of the disease is that luteinizing hormone, or LH, is sort of chronically elevated. It doesn't, luteinizing hormone is supposed to go up and down and up and down, throughout your cycle, the most important of which it's supposed to spike in the middle of your cycle when, to trigger ovulation. But occasionally women that have PCOS and have a chronically elevated LH, or luteinizing hormone, may, if you take an ovulation test throughout the cycle, because your LH is so high, you'll get a positive ovulation, and then you'll think you're ovulating, but in fact, it's just a chronically high level that is very characteristic of PCOS. So that can definitely happen, and is very characteristic of PCOS. And there are certainly, I would definitely recommend that you speak to your doctor about that, because we need to find the primary source of why your luteinizing hormone is sort of chronically high, and correct any sort of deficiencies or anything that could be contributing to it. So that's definitely a possibility.
Now we've had a few questions. And I was going to follow up. It should be positive for only 24 hours. Is that correct? Or 24 to 40 hours?
It should be positive for 24 hours. Yes.
Okay. Yeah. So yeah, beyond that, something's up. Something's
yes.
up. So, okay. So this is really interesting. So we talked about before we started this, that we've had a few questions on cholesterol lately. Mm-hmm. And I noticed on IVFMD's website, you guys have a blog, and it talks about, it actually came up in Google search because I was looking for this, but it also talks about how cholesterol impacts fertility. So, could you explain that, as it relates to inflammation and how that would be an issue?
Absolutely. So, cholesterol, and, there's good cholesterol, there's bad cholesterol. The good cholesterol is called HDL. The bad cholesterol is called LDL, and it has to do with how dense the protein particles are of the cholesterol. Be it the higher density lipoproteins are the good ones, and the lower density ones are the bad ones. And the way that lower density lipoprotein translates to sort of badness is related to inflammation, and also related to oxidative stress, or in the body. And certainly having having elevated cholesterol or triglycerides, or any combination of those two or both of them, can definitely, from an inflammatory perspective, can certainly decrease not only your chances of fertility, regardless of treatment, but also decrease your chance of success when you're doing something like IUI or IVF. So it's really important that those sorts of things be checked before you initiate any sort of treatment. I can't stress that enough. And there are, while the traditional medications for lowering cholesterol, things like statins, I'm not sure if people have heard of those, but statins we can't use in women that are trying to conceive because it's not safe to take when you're pregnant. But there certainly are like supplements and more herbal remedies that can be used in conjunction with lifestyle changes and diet changes that can really successfully lower the cholesterol to a point where it doesn't become a hindrance, where there's not any sort of issue related to inflammation or oxidative stress.
Very good, yeah. And omega-3s, probiotics, Mediterranean diet,
Yes.
those are all good. And I mean, how it impacts egg health would be basically based on the inflammation, the circulation impairment as well, right? As far as
Absolutely.
all that
100%.
goes. Would the same affect implantation? It's saying, well, can having high cholesterol affect embryo implantation?
I personally don't know of a direct, like I haven't read a paper recently that directly correlates elevated cholesterol to embryo implantation. But what I can tell you is certainly, actually, one test that we do routinely at IVFMD is to check the endometrial lining, or the lining of the uterus that's going to receive the embryo. We check it for any underlying inflammation, because we do that with a biopsy before we would put any embryo back. And we know that, and we check that because any sort of underlying inflammation can certainly decrease the chance of implantation and successful pregnancy. And so by a transitive property of whatever you want to call it, I would presume that, if you have very elevated cholesterol and with elevated inflammation and oxidative stress, that could absolutely contribute to a lower chance of embryo implantation for sure.
Yeah, and it's interesting. This question has never come up about cholesterol. So, and
I know,
now
and
we're
it
getting a
seems,
lot of cholesterol questions, but
yeah,
in the end, inflammation is inflammation, and so
100%, regardless
and
of how it comes about.
I would be curious to see if during this whole pandemic, we've seen a lot of our patients have a lot more anxiety, a lot more
Yes.
stress. And I just want to know what the impact of stress is on the cholesterol, because I have read that many times stress can impact cholesterol. So, it would be a good thing to research. So,
Absolutely.
so that, okay, so we also have had a question about, could I choose sex of baby when doing IVF? Do you guys do gender selection?
Yeah, the short answer is yes. So there's certainly one service that we provide at IVFMD is certainly something called family balancing. That would be a case where a family desires to go through IVF for the purposes of balancing out the family in terms of, or balancing out children in terms of gender. So certainly that can be done. And the process by which that's done is something called pre-implantation genetic testing. And the way that that's done is a small biopsy of a specific part of the embryo is done when the embryo is about 5 days old. And then we are able to send that to a specific company that is able to give me an idea of are there the appropriate number of chromosomes in that embryo. So a male would have 45 pairs of chromosomes plus an X and a Y, including an X and a Y. and a female would be 45XX. And so when you do that pre-implantation genetic testing, or PGT, you are able to see gender, and certainly when it comes to selecting which embryo you're going to put back, we always recommend at IVFMD that the highest quality embryo be the one that is selected to be put back into the uterus, regardless of gender, just simply for the purposes of success. But certainly, if you had two equal quality male and female embryos, that you could absolutely choose which gender you wanted to put back. So yes.
Very good. Okay, we have a male fertility question here. If a male wants sperm tested for count, motility, and health info, who does he go to?
So he can absolutely come to IVFMD. We provide full services for both female and male patients to an extent. So for our male patients, we certainly are able to do a comprehensive semen analysis, whereby the male produces a specimen via masturbation, and we're able to check the count, the concentration, the motility, the overall shape of the sperm, to make sure that everything looks okay. So that's definitely a service that we can provide. It sometimes depends on your insurance, whether or not you might need a primary care doctor to provide a referral to our center, or sometimes if you don't have insurance, sometimes you can come and request the test be done after you establish care with one of our doctors. So we definitely can provide those services for you. If you need something more extensive from a male fertility perspective, there are urologists that specialize in male fertility specifically, as compared to people like me and the other physicians at IVFMD. That while we do still, of course, treat men, we're certainly OBGYN doctors first by training, so specialize more in women, but absolutely can help both people.
Yes, and we have been seeing a few of the partners lately, as far as in our acupuncture clinic.
Oh, great.
And I think that again, blood flow, stress reduction, all those are important for inflammation as well with the guys
Yeah.
too. So we try to work on that as well with them, and if they're able to come in, which a lot of times we don't see the other half in here, but it is nice when when they can have that experience as a couple as well, to come in and treat together. So
Absolutely.
so we encourage that as well. And some people are, do you guys treat men? And like, yeah, we do have some male patients, but
Of
again,
course.
mostly female, but we do.
Yeah. I always like
And
to
so
say it takes two to tango. So
yeah, like definitely,
the
it's
guys
good.
are just as important. So come on in. Don't be afraid.
Yeah, definitely. And a lot of people are like, oh, I didn't realize I was so stressed. Like I didn't realize that until I got a treatment, or I was, I kind of started to come in here. So, sometimes we carry that stress with us and we think that we're fine until we actually really get into parasympathetic mode. That's kind of our goal, is to try to flip the switch a little bit and relax the sympathetic nervous system into out of fight or flight and into our feed and breed, or rest and digest mode, and that's kind of one of our goals for sure. So so definitely the partners are welcome to get definitely get checked up as far as that goes. That's pretty straightforward, that process, and then also if there's any history of issues where you've been trying for a while, and sometimes we see just the female has had all these different procedures, and the guy hasn't even had a semen analysis. It's like something is missing here. So
Yes.
for sure get checked out. And so there is another question here. Unexplained infertility diagnosis, failed 1 year of medicated/unmedicated cycles with timed intercourse or IUI advice.
So if they truly have, unexplained infertility is really tough for people who don't know. what unexplained infertility is. It's that I do every test that we have the ability to do on both the male and the female, and just about and everything comes back normal. Meaning, there is no clear explanation for why a couple is struggling to conceive, and it's a very frustrating diagnosis because it would be great if you say, oh, I see this problem, let's fix it, and then then you get pregnant. But unexplained infertility is just that, is that you don't have an answer. And certainly in someone that has been, my advice would be in someone that has done either medicated or unmedicated timed intercourse and IUI cycles over the course of a year, I think it would absolutely really be time to sort of regroup with your physician. Or I don't know if that person is seeing a reproductive endocrinologist, like an IVF doctor, but if they are, to regroup and strongly consider moving on to a different treatment, something like IVF, I think would be warranted in that regard. And certainly if that individual has not yet seen a fertility specialist, that they definitely should strongly consider making an appointment, especially after a year of trying all of those things.
Yes, definitely. And as far as we did miss a question that was submitted a little earlier in this, I'm scrolling down the feed here, from someone who has endometriosis. She said, women who has endometriosis, is it harder to conceive? I had my first laparoscopic, I can't speak today, surgery in August. I am stage 4 and I'm 29 years old.
Yeah, endometriosis is also really tough. As she mentioned there, endometriosis is a staged disease, that can only be staged by doing surgical procedures. And stage 4 is definitely an advanced disease. And we do know that even though she is young, 29, that just the inherent pathology behind endometriosis, which is actually quite inflammatory based also, can have a very negative impact on ovarian reserve for sure, and the quality of the eggs, especially if that individual has any sort of endometriosis implants within the ovary itself, something called endometriomas, whereby you have the cysts, of endometriosis in the ovaries. That environment is a very harsh environment. It can be like an acidic environment and an inflammatory environment that can damage the surrounding healthy ovarian tissue. So unfortunately, it definitely can make things harder. And as of right now, where you have youth on your side at the age of 29, I would try to strike while the iron is hot and make sure you have an understanding about where you stand from an ovarian reserve perspective, sooner rather than later.
Yeah, very true. And we've definitely seen many endometriosis patients throughout the years, and we, in Chinese medicine, we look at blood flow is very important. We look at the period kind of as a report card to see, and a lot of times that will improve that pain, those clots, the color even will change during the course of the treatment, which is really nice. And again, we're working on inflammation as well, and changing up the diet a little bit, maybe doing some herbal treatment as well, and working with the strategy of, not really like a suppressive strategy, because if you are trying to get pregnant, the last thing you are going to be doing is taking birth control or Lupron or any of those things for a very long period of time. And instead of just basically trying to reverse some of these things. And I think we have seen a lot of progress with a lot of patients. They've been able to get out of pain during their cycles, and also with an integrative approach sometimes on their own, they're able to get pregnant. So that is, it's important though, like you said, to address it when you're, in your 20s, in your 30s, try to not wait till the damage might have already been done. And then, it's tough, it is tougher because so many years of chronic inflammation can really wreak havoc, like you said, on egg quality and many things. Surgery after surgery, can be damaging for the lining sometimes. So we try to work with patients who are, who've had a lot of surgeries as well. We try to do some body work with them, actually external work with that. So yeah, I mean, all these things can definitely, the more factors involved, sometimes the longer it takes, right? So that's why we want to get a head start as much as possible.
Absolutely.
So,
I couldn't agree more.
yes, for sure. And as far as, we did actually have another question here. What is your opinion on adding HGH for someone age 40?
So HGH, or human growth hormone, is something that I do definitely use during IVF stimulation, especially in my patients that are a little bit older and who also have diminished ovarian reserve. I find that the addition of it can help recruit a larger pool of follicles, which ultimately can be beneficial, on the other end when we're looking at embryos and trying to get to the point where we're able to genetically test embryos. So I am definitely in support of using that, again, in my patients that are older who have diminished ovarian reserve, or for some other reason have very compromised egg quality.
Okay, right then. Yes, because that question does come up. Then we have, someone's asking, they're saying it's been very helpful, insightful. Thank you so much. And is this being recorded? Yes. So we are on Facebook as well right now. We're not sure if that will actually go through because we're having some issues with Facebook. But this is actually going to be recorded on my Instagram. And it will be under IGTV, the little setting there. And I'm also going to post it to my story right when we finish in a few minutes. So thank you guys for asking all these wonderful questions. And this is why we do it, because I always learn something new every single time. And I've been doing this for 20 years. So you can imagine, a long time,
Never stop learning. Never stop learning.
Yes,
that's my policy.
I really enjoy it. And so thank you guys. So what is your suggestion for someone trying to conceive with a normal TSH level but super high thyroid antibodies?
The dreaded thyroid antibodies. Yes. So thyroid antibodies, there is so what you're sort of describing, let me backstep a little bit. So as reproductive endocrinologists, we like our thyroid level, or our TSH level, to be less than 2.5 as a goal for really optimizing body wellness and the thyroid function ahead of getting pregnant or initiating any sort of treatment. And but there are certainly a subset of women that have a TSH less than 2.5, but have thyroid antibodies that are quite elevated. And what a thyroid antibody means is that your body has generated antibodies against your own thyroid gland that can compromise the function of it. And I am almost always in support of trying to use a low dose of a medication called Synthroid, which can help improve thyroid function, especially in my patients with very high thyroid antibodies. And there is some evidence to suggest that using Synthroid can lower the antibody level significantly, to a point where it will have less of an effect on the thyroid itself, and therefore less of an effect on any imbalances having posing a detriment to conceiving or increasing the chance of miscarriage or anything like that. So I would definitely support anyone who has very elevated thyroid antibodies, assuming your TSH level is not extremely low, but that there is sort of wiggle room to tolerate a very low dose medication that you would take every day.
Yeah, and I mean, the question of normal TSH, that's a whole other thing, right? Because I mean, a lot of people do say, oh yeah, it's normal, and then you look, you're like, but you know that there's a different range. When we're talking about pregnancy and fertility, it needs to be a little lower than what the standard ranges will show on LabCorp Quest or or from your primaries, perhaps it's not going to be flagged sometimes, but we're looking at usually patients with, should have a less than 2.5 TSH, right?
Yes.
Under 2.5.
Yes.
So if it's over 2.5 or TSH, then, you know, it's not considered normal usually for us, for our purposes. And even now they've actually updated in Quest, I think, for the first trimester, they have the ranges there now, first, second, and third, and you'll see that they're a lot lower than, you know, your normal ranges, I guess. So yes, so she's saying level is 2.9. So yeah, I suspected, Valerie, that was not normal. So, you know, in that case, still, yes, like you're saying, the Synthroid and working with the diet a little bit, like, why is the thyroid creating antibodies? There shouldn't be any in the first place. Like, it's doing that because there's inflammation going on somewhere. So that's important to address for sure.
Absolutely. Yeah.
And I'd say, like, with HCG levels, that when they go up, we see that sometimes with patients where the TSH also goes up. So you've got to make sure that that gets monitored.
It's very important, actually, when you, as soon as a patient who is on thyroid medication becomes pregnant, your need and the way that you metabolize the thyroid medication when you're pregnant increases significantly. So you actually need more thyroid medication in order to keep your thyroid in check when you become pregnant. So the moment you become pregnant, if you're on thyroid medication, call your doctor's office, let them know, and what they should do is increase the dose of your medication when you become pregnant.
Yeah, automatically, and have it monitored like every 4 weeks, right? Or,
at least.
Or so.
Yep.
Yeah. Okay. And so Valerie, that's a great point that you brought up, and hopefully you can have your practitioner check that for you as well. And
good luck.
Sure yes. Yeah. Or you can call Dr. Bauer. You know.
Absolutely.
IVFMD. So we have.
I love treating thyroid problems.
Yes. Yeah, it's super important. So and so we have we almost are out of town. We have 5 more minutes, guys. So we're gonna answer our last few questions here, and I know then we'll let everybody go and let's see. This is a patient who said she had cervical stenosis. A week ago, I had surgery, hysteroscopy. Can it improve my fertility?
Definitely. On cervical stenosis is tough for people who don't know what that is. The cervix, which is sort of the opening of the uterus, can for sometimes become very scarred or have scar tissue or that make it very difficult to pass anything through the cervix. And sometimes women that have had surgery on the cervix before, or if you've had something called a LEAP procedure, which is something that sometimes needs to be done if you have a very abnormal pap smear, that can result in cervical stenosis, or having any sort of a procedure on the uterus itself whereby an instrument needs to pass through the cervix, potentially can, depending on the individual, can increase the chance for cervical stenosis. And certainly if the cervix itself is closed and is scarred over, and we're not able to, and nothing is able to pass, that includes sperm, even though sperm is microscopic and can certainly make its way into places better than other things because of its size. But having that resolved and treated will absolutely, help improve things for sure.
Definitely. And we have one last question here. Oh, wait, actually, it's the same question. All right, so I just saw that. But let me make sure that we got to all of our previously submitted questions. Oh, we did not. Okay, so there's one for those who can't swallow vitamins, what chewables are the best to use? I looked this up actually because I was like, well, that's a good question. I don't know. Do you have any recommendations? Or
I don't. I saw that one also and did a little bit of research and didn't find a whole lot that was particularly helpful. I would defer again. We can certainly ask Marta, who's our nutrition and who's our supplement guru in IVFMD. But maybe something to consider is trying alternative methods to get the pills down. Maybe by putting it in a piece of food and swallowing it, and in that regard, just to try to get it down. Unfortunately, I'm not as familiar with chewable higher quality supplements. I know there probably should be a market for it, because I know a lot of people do struggle sometimes with taking supplements, but I'm not really aware of any good ones, unfortunately.
Right, because I mean, I do see some that are like Garden of Life has one it's like a whole food one, but it doesn't have necessarily folate. So you want to find something that has that 5 increase that type of folate that everyone can absorb. And
Absolutely.
maybe, that would be a great question for Marta. So
Yeah.
Marta, if you're listening, please post what's a good chewable. We don't have one. And then the other question we had, we didn't get to was, let me just see here. Are there what long-term risk are there to multiple rounds of IVF?
So the risks of IVF generally, thank goodness, are low. But there is some evidence to suggest that after about 5 to 6 cycles of IVF, that there is a slight increased risk of what we call a borderline ovarian neoplasm. So what does that mean? Is it, people say, oh, if you do IVF, you're going to get cancer. No, that's not the case. But there have been studies to show that there's there is an increased risk with, like I said, with 5 or 6 cycles of IVF for a borderline ovarian neoplasm, which means that it's a borderline neoplasm, so it's not malignant. But it does potentially has the potential to get there, but it is not considered malignant, nor is it necessarily, it's mostly benign, but certainly that is the most well-studied increased risk of multiple IVF cycles that I'm aware of, that I tell my patients about as well.
So that is in the uterus, right? What you're saying?
No, ovarian. It's in the ovary.
Ovarian. Okay, sorry.
Ovarian.
Okay.
Yep.
Ovarian.
Yeah.
Yes.
Which makes sense, because you're stimulating the ovaries, you're poking them to get the eggs out, and you're doing lots of things to them, and doing all of that 5, 6, 7 times over is it's not surprising that there are some consequences to it.
Wow, I missed like a few questions, but we're going to try to answer 5 questions in 5 minutes. Can we do this?
Let's do it.
Let's do it. Lightning
I'll
round.
keep it short.
Okay, here we go. Optimal A1C for a type 1 diabetic before starting IVF and embryo transfer.
So I work very closely with my maternal fetal medicine or high risk obstetric doctors, and so I generally defer to them on that. However, for a type 1 diabetic, I believe the goal should be at least less than 7.
Okay, good. Possible causes for poor ovarian response despite a normal AMH, estrogen, and multiple follicles.
So there are a lot of factors that we don't know. I guess I would pose to that individual, have you had your body-wide, systemic inflammation checked? Are there other things going on? I think the question was just about ovarian, not embryos, right? Because
poor ovarian response, right?
Poor ovarian response, yes. So is there an inflammatory process going on? Potentially is the protocol of medications that is being used for your stimulation maybe not ideal? Have other things been tried? Everyone responds to medications differently. So I would say to have the doctor that you're working with look at that. If there's underlying endometriosis that might be undiagnosed, that can contribute to poor ovarian quality as well.
Okay. Are tubal ligation reversals successful, more or less?
Tubal ligation reversals are they can be successful, but the likelihood of success depends on a lot of factors. The main factor really has to do with how much of your remaining fallopian tube is there. Excuse me. Because some people remove a segment of the fallopian tube when they do a ligation, and if there's not enough length to the fallopian tube left to put it back together properly, then the likelihood of it working and the likelihood of the tube functioning properly after the surgery becomes very low. And generally, reversing a tubal ligation is associated with an increased risk of what we call an ectopic pregnancy, or a tubal pregnancy, just because the fallopian tubes are very delicate, and whenever you do surgery or manipulate them or anything like that, they can develop scar tissue, which ultimately doesn't allow the embryo, which is created in the fallopian tube, to travel to the uterus to implant where it should be. So make sure you talk to your doctor about reversing a tubal ligation versus potentially moving just to IVF, which doesn't require any fallopian tube surgery at all.
That's really why it was invented, right?
Yeah.
People with fallopian tubes. And what do you, okay, supplement question again, what do you think about Ovasitol? That's a 40-to-1 myo-inositol to D-chiroinositol ratio is what is in the formula with Ovasitol.
That is a good ratio. I like that ratio. And it's very important that you take a look at the ratio of the myo-inositol. If you take a look at the ratio of the inositols, because the correct ratio is really important, because an incorrect ratio can actually do more harm than good.
Yes.
So and the product that I like a lot is the Theralogics Ovasitol. They have a very good high quality product with the appropriate ratio.
Yes, and it's powder, so the person who
put it in a drink.
Swallow pills, you can just
Yeah.
stir it. Yeah. Stir it in your smoothie, or just
Yes.
take it regular. It's kind of like a sweet taste, kind of. Okay, so I think we almost did it. Should we take one more question? This is the last question, then we're gonna go. Okay, here we go. Let's see here. What can we do for low sperm motility?
Low sperm motility. So one thing that certainly can be done for low sperm motility is intrauterine insemination. And because what that does, when a sperm has low motility, it might not be able to get from the vagina through the cervix into the uterus up to the fallopian tube where it meets the egg and fertilizes. And if it can't make that trip, we can help it by doing intrauterine insemination, whereby we put the sperm and place it at the top of the uterus, so it has less of a distance to travel in order to get to the egg. So that's certainly one thing that can be done. That's definitely a good place to start. Some people that may not work, depending on the degree of how poor the motility is, and sometimes IVF may be necessary.
Okay. Whew, I think we did it. Maximum age for IVF. Oh gosh, you guys keep asking these good questions. Maximum age for IVF. Okay. Well, let's see. Go ahead and take it. I mean, there's donor IVF. There's fresh. There's
Sorry. What are the kinds of IVF? Is that what the question?
What's the maximum age? Is what someone just typed here.
So, and in our practice, there are certain criteria that if you'd like to use your own eggs, and you're, over the age of 42 or 43, that your hormone levels and your ovarian reserve needs to be of a certain level in order to for us to consider allowing you to move forward with IVF. So if you are open or willing to use a donor egg, then generally we can accept people that are in their mid to late 40s and even into their 50s who are willing to utilize an egg of a younger woman.
Yes, and we have patients in their 40s or mid 40s also doing IVF. And doing also, I mean, there's so many different routes, I would say,
there are.
Trying naturally in the early 40s, but we definitely see a decline after 44. And with your own, I mean, when trying naturally, it's very difficult, but
Yes.
It's not impossible. There are people that definitely get pregnant. We saw someone get pregnant, walked in to our office many years ago that was age 47 and, had, a natural pregnancy.
It happens. Yeah. So nothing is impossible for sure, but it does become less likely, but not impossible.
Yes. Thank you so very much, Dr. Bauer. This has been really fun. And thank you guys for chiming in. We will be back this month. I believe that Dr. Gelman and I are going to do another live, and Dr. Wood. So please, join us again. We'll have those dates that we'll post on our Instagram. Please follow Dr. Bauer as well. What is your Instagram? How can they find you?
Yeah,
Dr.
absolutely.
Bauer?
My Instagram handle is Jessica Bauer, Bauer _ fertility doc. So,
Cool.
and yeah, and I should probably be listed somewhere in the IVFMD, if you go to the website and see my name, but generally Jessica Bauer _ fertility doc.
Cool. Okay, everybody. Thank you so much. And we will post this again if you guys want to share this, because there's so many jewels here that I'm really excited to share it. So thank you very much. And we will be back in a few weeks. So good night, everybody.
Good night.